Okay, so now we will be looking at different type of valvular diseases involved in the heart. So the first and most important is mitral stenosis. Mitral stenosis is stiffening, hardening of the mitral valve, and the murmur present in mitral stenosis is rumbling mid-diastolic murmur with low pitch with opening snap. It is best heard in mitral area and in fifth intercostal space, and on expiration patient lying on left mitral stenosis sound heard. Mitral regurgitation means when the blood flows backward from mitral valve, that's known as mitral regurgitation, and in this systolic murmur is heard, and this radiates to the axilla. Aortic stenosis occurs when a stiffening, hardening of the aortic valve causes ejection systolic murmur which radiates to the carotid, and aortic regurgitation presents with early mid-diastolic murmur and aortic regurgitation. So in this way, these murmurs are present: mid-diastolic murmur and rumbling murmur. And the most common heart murmur are mitral valve prolapse. Most common cause of bacterial endocarditis occurs in the mitral valve. Valve in endocarditis and IV drug abusers occurs. Tricuspid is most commonly affected. Hypertension most commonly present is essential. 95% of cases are the essential hypertension. In children occurs because of renal disease, cystic disease, or Wilms tumor. Hypertension in young women occurs because of oral contraceptive pills. In myocarditis occurs most commonly because of Coxsackie-B virus, and right heart failure most commonly occurs because of left heart failure. So in this way these presents. Site of atherosclerosis most common site is aorta, then coronary arteries, then popliteal artery, and then carotid artery. Vasculitis is inflammation of the vessels. Most commonly is temporal arteritis. Acute mitral insufficiency is cause of the disease. Aneurysm is most common. Abdominal aneurysm is present, and atrioventricular fistula is penetrating knife wound most commonly present. Now, cardiomyopathy most commonly is dilated cardiomyopathy, and causes of acute endocarditis. Most commonly cause of acute endocarditis is strep aureus. Most common cause of subacute endocarditis is strep viridian, and in congenital anomaly most commonly VSD is present. Ventricular septal defect and congenital early cyanosis with teratology of fallout is present with cyanosis, early cyanosis. Coronary artery thrombosis most commonly left anterior descending artery occurs, and death in hypertension most commonly occurs because of acute mitral insufficiency. Late and second lenticular stroke and renal failure is there. Okay, so now we will be looking at abdominal aortic aneurysm. Now, as word indicates, aneurysm means aneurysmal dilation of the aorta, abdominal aorta, that results into the abdominal aortic aneurysm. Risk factors are age greater than 60, smoking, male sex, hypertension, or history of atherosclerosis. Presentation: how patient will present? Patient will be asymptomatic mostly. Rapid expansion will be there. Dull abdominal or back pain will be there. Rupture of aneurysm, severe abdominal back pain, shock, umbilical flare, hematoma is there. Management will be smoke cessation and elective or urgent repair in abdominal aneurysm. Smoke cessation and urgent repair is the management of the choice. Another disease is corrugation of aorta. Now, etiology of corrugation. Corrugation means narrowing of the parts of the aorta. That's known as corrugation of the aorta. Etiology is congenital, acquired arthritis, upper body. It is present in well developed. Lower extremities undeveloped claudication will be there. Brachial and femoral pulse delay will be there in the patient. Upper lower extremity blood pressure will be there. Left intracapsular systolic continuous murmur and hypertension will be there in the patient. Corrugation of aorta occurs, like let's suppose this is aorta, normal aorta, but what happens when the aorta is constricted, narrowed, that's known as corrugation. So narrowing of aorta is known as corrugation of aorta. Now, diagnosis will be based on ECG shows left ventricular hypertrophy because aorta is narrowed and blood has to pump against pressure. That's why left ventricular hypertrophy will be there. Chest X-ray shows inferior notching. Three signs due to aortic distension will be indentation will be there. Echocardiogram shows uh, balloon angiography, and treatment is balloon angiography, stent surgery, and stent placement will be there. So in this way, abdominal aorta, corrugation of abdominal aorta can be treated. Now, another cardio-related disease is infective endocarditis. There are different types of infective endocarditis because of different etiological factors. In healthy people, staph aureus, then viridian, then staph epidermis will be there. IV drug abusers have staph aureus most commonly. Prostatic valve have staph epidermidis. Prostatic valve have staph viridian in late attack. Presentation: patient will have fever, diastolic murmur, mitral valve insufficiency, petechiae, sphincter hemorrhage, clumping, ocular node, ganglion, and evidence of embolization with splenomegaly and Roth-Sport. Now, it can be memorized as a fever, Roth-Sport, ocular node, ganglion murmur, and sphincter hemorrhage. Jones criteria can be memorized for this. Diagnosis will be based on major criteria like positive culture, endocardial involvement, echo on vegetation, new valve regeneration. Minor criteria are fever, IV drug abusers, embolic phenomena, vasculitis, suggestive of blood culture, and echo finding. Diagnosis will be based on two major and one major plus three minor criteria. Treatment will be vancomycin, aminoglycosides, and rifampicin with prostatic valve, and surgical valve replacement is also treatment of choice for infective endocarditis patient. So these were some diseases and high yield points from cardiology. For other high yield points, do follow my playlist of cardiology in which I have uploaded other cardiological diseases and their clinical management.